طيب بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله الأمين. Welcome everybody, and I would like on behalf of the Sudanese CBHQ, CIC, CBBS, Six Sigma, PMB Group, and Patient Safety Group, I'd like to welcome Mr. Adnan Khalid. Mr. Adnan, he is the Director of Oversight of Business Unit for the South region. From the advertisement, we send it into the different group. Mr. Adnan has a long experience in project management, risk management in different sectors. He has higher education from London School, and he has master also of business administration. Actually, we are very glad to be with you today, Mr. Adnan, and we are talking about the risk management in healthcare. And we are aware risk management is a very important topic. As we are talking about the different certificate, definitely when we look for the project management, it is a core element. When we talk about Six Sigma at different level, it is a core element. When we look for the infection control, it is a core. When we look about the patient safety, also is another core. Also, let me to welcome His Excellency Professor Zuhair Al-Subai today with us, and this is a great pleasure to be here. Now the floor is yours, Mr. Adnan, and feel free to start.
Thank you so much, Dr. Haytham, for arranging this session today. I'm pleased to share the risk management knowledge with the participant today, and I hope this session will be very useful for the participants. So without further ado, I'm just going to start providing the risk management session. So let me begin with providing the key components of the risk management. Basically, due to the time constraints, we are unable to go for all these steps here because all these four components are equally essential for the risk management. But today, since we have a limited time, we're going to just focus on to the risk management process, and we'll arrange, inshallah, with the rest of the components in the later stages. So in today's session, we're going to talk about the risk identification, assessment, risk response, monitoring, reporting, and ensure all the risks are visible across the regions and across the functions that being working for, and establish the mechanism for informed decision making. This will not make you the risk specialist or risk having a great understanding of the risk, but it will just give you the approach, basic understanding of the risk management, how everyone should look at the risk management and identification assessment perspective, and make sure the risk prioritization all the way to manage in the properly managed manner. So I'm going to start first. Please make sure that this is going to be a more interactive session. So if anyone has any question, just stop me so I can elaborate more and have a more discussion around the risk management. So make sure that everyone understands the component of the risk management. So when we talk about the risk management, it's a risk is the uncertainty. The risk is something like, for example, when we always think about the risk, it's something like unclear, is unpredictable, or we would say like this is not being clear to anyone who could understand the upcoming the events. So risk is a future event that may happen, it may not happen, but if it's happened, it may affect the project outcomes, and it will change the outcomes of our desired goals. So we make sure that whatever the risk management that we undertake, it should have the proper management of it, and make sure that we do all proper precautions to make sure that it's managed and covered all the way around. So the type of risk is basically, there are three types of risks. One is the ordinary risk, which is the early identification of the risks, where anyone in the organization, whether it's the project level risks, whether it's the organizational risks, whether it's any level of the risk that we are pursuing in terms of any particular activity or achieving the objects, or willing to achieve some targets. So initially, I think we aim to ensure that what are the risk identification. The risk identification is basically, which is the ordinary risk, is the early identification of the risk. And the second thing is the residual risk. Residual risk mean the threats remains or not eliminated after the risks executed in the risk response plans. Number three is the risk response, the secondary risk, which is arise directly from the outcome of the executing the risk response. I'm going to explain these three areas, three risk types in the upcoming slides. So there are a great confusion I've seen. Most of the people, they always get confused distinguishing between the risk and issues. As I mentioned, risk is the future event. It may happen, it may not happen. But if it happens, it may change the outcome of your desired goal. But the issue is basically has already happened. For example, if we talk about the current situation that we are into in the pandemic. So if someone is affected, it means this has already happened. It's not an issue anymore. But when we expect something that is about to happen, for example, we are expecting to have 10,000 cases a day, this is potentially a risk. And because it's not happened, so we just need to make sure that this potential risk that been identified based on the different dynamics, different trends that we see across the different dimensions. So this will help understanding more procedural way of identifying the risks. So as I mentioned that there are risks which the issue definition and the risk definition is totally different than each other. I'm just going to go for the key guidelines and the principles. There are certain elements everyone should understand during the course on managing the risks, that the transparency is the key. And all the risks are comprehensively documented and visible to all relevant stakeholders, even the project managers, the physicians, anyone who handles some sort of initiative. They ensure the transparency of logging and providing full comprehensively documentation of the risks. Until they hide the risk, it will cause the failure of the project or failure of unforeseen events. The awareness is basically, the risk awareness is a part of overall, the organization culture and promotes collaboration on the risk activities. So we make sure that whenever we have certain objectives, set objective within the organization, we collaborate and we ensure the awareness amongst the team to ensure that the risk culture is being adopted across the organization. Everyone understand what is the risk is all about, and they think about risks. They always try to find out the potential risk that will hinder the achievement of their projects. So, or it could be projects. So I'm going to be using the terms of projects more often because it's very much aligned in the situation that we are into in the transformation journey that we are into. The ownership is basically whenever the risks identified, and the risk ownership has to be determined because the owner of the risk will be able must be able to put up the risk response strategy in order to make sure that the risk is being taken in account and put up the right mitigation strategy to mitigate or minimize the risk impact. The compliance is basically to ensure that whatever we do in terms of the scope that we are into, we adherence to the compliance and the regulations that we have in place. And the proactiveness, risk is always proactive approach. It's never been in reactive. So we make sure that before executing anything that we do in our normal professional life, or even in the normal life, we think about risk more proactively. Think about the uncertainty, think about the future event that could impact the achievement of whatever we are doing. So it's always been a proactive approach rather than the reactive one. So what is risk is all about? So I'm going to explain the risk. Mostly people think about, the risk is mostly, like dealing with the statistics, with the complex process, and which is very difficult to comprehend, and difficult to just narrate, or difficult to just reflect into the future events. But that is not the fact. Basically, I believe, and even it's been recognized internationally, the risk management is one of the most natural things we do, and one of the most important. So I'm just going to give more concise examples that risk management is essentially asking and answering 6 basic questions. The 6 basic questions are: what are we trying to do? What might affect me? What are the risks that matters? What shall we do about it? And did it work? I mean, the risk that we are mitigating and the risk response strategy taken forward, did it work? And then the final one, what changed? So these are the basic 6 questions, and once we answer, we will be able to answer the risk response strategies. So number 1 is, what are we trying to achieve? And this leads to question number 1, which is, what are we trying to do, is setting the objective. So while setting the objective is any organization, when we go in the healthcare organization, in any different corporate world. So the basic things that we try to identify risk is starting with the writing, understanding the scope. What is the context? What is the environment we are into? And what actually we are trying to achieve, from which that we need to identify a risk. So first thing is to identify the objectives. So once the objective is identified, the second thing is what might affect me, which is there anything in the future which could either hinder my achievement or achieving my goal, or maybe even help me. So there are 2 scenarios: either it's gonna impact me, or either it's gonna be an opportunity for me that exploit to have more opportunity in this context. So once we talk about the risk, what might affect me, is reached to the point number 2, which is step number 2, which is the risk identification. Risk identification is basically finding the uncertainty that matters, the future events, if it occurred, would help or hinder as we are trying to achieve our goals. So the risk identification is basically a complete process, which hangs into two steps, which is the top-down and bottom-up approach. So in the risk identification, the process is, whoever is the project manager, whoever is the owner of the project, whoever is the leading any of the objective, he should bring all the team members part of the project team and do the brainstorming session, conduct the scenario analysis, which is the fishbone analysis, what if analysis, and conduct interviews. This is basically the interview. This is basically the from bottom up. The top down basically is to seek the guidance from the senior leadership, that how do they see from the overarching perspective, because there are different environment, there are different trends, and there are different situations that we don't have the visibility to it, but the senior leadership who have the visibility how the risks are being in the overarching perspective. So in the risk identification, we make sure that all the team members are part of the risk identification, and then we consider 2 scenarios, which is the top down and bottom up, and do the
ماشي من عارف هيشوفك ده كله هيقول لك هات السندوتش
Excuse me, please unmute your mic, please.
Yeah.
Yeah. Make sure your mic is mute, please.
All right, so we talked about here is the top-down and bottom-up approach. And once the top-down and bottom-up approach is done, the main thing is what we need to write up into the risk register is writing the risk description. The risk description is basically the component of the three elements, which is a cause, an event, and consequences. This description, so as long as you are defining your risk description within these three components, it will elaborate, it will provide more clarity that what are the causes and event and consequences that you are facing that will hinder the specific objective that you are trying to achieve. So in this context, I'm just going to explain the three elements, which is the cause, event, and consequences. The cause are the source of the event, which is the reason why the risk could happen. And the event is the incident or occurrence that arises from cause. And the consequences is the effect arising from the risk event. So when we talk about these three statement risk description, I've elaborated in colors, which is lack of stakeholder buy-in as an event, may affect the project timelines, which is the consequences due to insufficient communication or program. So writing up the description basically hints on this very specific, concise statement, right? And that should reflect these three elements, which is the cause, event, and consequences. So we make sure whenever we start doing the risk identification, we put up the risk description that should cover these three components, which is cause, event, and consequences. So this is basically the risk categories. This risk category is basically classified or identified based on the situation we are into. Sometimes we define the different categories that in the business we are into. It depends, and it can be changed as per the organization or as per the project you are working in. So I'm just giving an example. For example, for example, strategic risk, financial compliance, operational. These kind of risks are more common into any organization which they are trying to find out if there is any strategic impact within their project, what kind of financial impact that will hinder the project outcomes or that will catastrophically impact the budget or the financial element, and what are the compliance impact that they are going to face in case if it's not being followed, and the operational risk, that the routine work that anyone can do in terms of achieving or providing any sort of specific activities. So risk classification or risk categories can be defined based on the situation that we are in, anyone into. So please make sure that everyone has the clarity on this. In case if anyone needs any clarification, let me know about it. So risk category is very key element, and it will help also, whoever's trying to identify risk. If you put the risk category earlier on in place, it will help to identify risks. For example, as in our transformation journey, we are always seeing a lot of building capability sort of risk. So we can put like one of the risks is the building capability and capacity planning perspective. So anything related to this aspect, if we put these categories as the building capabilities, then it will be easier for us to define what kind of a risk that we might face in terms of achieving the objective that we are into. So risk categories are equally important to identify, and also it helps the risk identification process. So I just would like to open a discussion call here because the first step is the risk identification. I just wanted to understand if the team understand what is the risk, what is the difference between the risk and issues, risk identification process, top-down and bottom-up approach. If you have any question, I'm ready to answer it. Please, it's an open discussion. Please go ahead.
Thank you so much. Thank you so much, Mr. Adnan. This is, I think, the first step, risk identification.
Yeah.
Any question? Any question now? just to make it more interactive. Any question maybe in the chat, or you can ask directly.
Yeah, if there's no question, please, I would encourage team here, people, participants, to write up their question and anything that they see facing challenges in terms of risk identification, we can talk about more, because this is one of the main step. If we did not go well, then the entire the next steps, the following steps will not be as accurate as it should be. So I encourage the team members, all the participants, to make sure that they have the very much clear understanding on the risk identification process. Okay.
Yeah, the question here, Mr. Adnan, we know that most of the healthcare professionals working at different level of healthcare. So who is going to do the risk identification, and what are the tools and technique that can help the different health care providers at a different level, whether at corporate level or management level or even hospital level, to identify risk? Thank you.
This is a very important question. Actually, risk identification is the responsibility for everyone.
Okay.
So it's not about that if someone in the hierarchy is the lead or manager or director and he's responsible for risk identification. It's the responsibility for all the team members that are working within the organization, whether it's the healthcare organization, whether it is the corporate organization. So it's everyone duty responsibility. Yeah, the mechanism for risk identification, as I mentioned earlier, that the brainstorming session, first of all, we just want you to understand what is the context, what is the objective, and what are the goals we are trying to achieve. The first thing we need to put in front of us, the objective we are trying to achieve. Based on this, because since, for example, a project manager, he understands that what he's trying to achieve by end of the project. And then as he's an expert of that particular project, that he needs to bring all his team members that was working within that project to start brainstorming session. In this brainstorming session, you could go different scenarios. As I mentioned, what if the fishbone analysis, what if analysis, and then you can go the root cause analysis, and also general discussion around that potentially in the future that anyone sees that could hinder the project outcomes. So this is the collective effort of the team members in the brainstorming session. Once the brainstorm, whatever the risk will identify, we make sure that we log those risks into the risk register, regardless of the risk, severity, regardless of risk impact. This is a risk identification. Whatever comes in mind, just log it into the risk register. Because after logging the risk into the register, the second step is to risk assessment, and then we look at what risks that matter us. A lot of risk will be eliminated. A lot of thinking around that we get into the process of brainstorming will eliminate, but there will be a set of risks that are really going through the risk assessment, the second stage. Yeah.
Thank you so much for answering the question. Professor Zuhair, the floor is yours, and welcome again.
Thank you. Let me say that it was for me very clear, very interesting, and informative. The only thing that these are basics for the risk management, which would need some sort of a workshop to learn how to adapt it. I think this is very important. And if Mr. Khalid agrees, we can host such a workshop in Sibai Group, take care of it, and it will be again online. So I would, this is my suggestion, and I would leave the decision to you. But it's very interesting. I enjoyed it, and I learned a lot of it from it. Thank you.
Professor Zuhair, basically, since we have the limited time here, normally the risk, basic risk understanding or risk management workshop or training is things at least for 3 to 5 days, between 3 to 5 days. And since we have a very limited 1 hour and a half, so I'm just trying to make sure that we go at least for the basic fundamentals of the risk identification, risk assessment, the other areas. And then inshallah in the future, when we have any opportunity, then maybe we're gonna go like more kind of in series perspective, like continuous series, where we can just pick one portion of the risk steps, and then we can do a more exercise and workshop in this context.
Yes, this is what I mean. A 4 to 5 days workshop, and we will be more than happy to host it.
Lovely.
Anytime. Thank you very much.
You're welcome. So
Thank you,
I
Prof.
think Hiba,
Yeah, Hiba, yes.
yeah, there was another hand raised.
Yeah.
Somebody raised hand.
Hello, good evening.
Good
Yes,
evening.
good evening.
Thank you very much for this very enjoyable session. I would like to ask the presenter about, I am working in an emergency situation, which is risk all over. But I would like to ask if within the next steps from identifying and going on, if he can just relate these steps to the emergency situation, working in camps and so on. I have been looking at it from my side of view. I'm working in a camp dealing with refugees, and we are facing rainy season. So I am going next step to find out the risk factors. We are already doing this. Find the risk factors without this very knowledgeable steps, but I am going to relate it now to find the risk factors within the rainy season, malaria and other things, diarrhea and so on. So and we already answered these 6 questions with just experience, not in this scientific way. But I would like him, if it's possible, to just arrange these things with emergency.
Yes, absolutely. We lost you.
Also, I would like to. Yes, I'm sorry. Also, I would like to ask another question. The presenter speak about, Dr. Adnan speak about, this is just basic knowledge, as he said. Can we use this session and this basic knowledge to implement it in our work? Is it good, or we try to find another deep information to try to implement it? Thank you very much.
Absolutely. Thank you, Dr. Hiba. Actually, regarding the situational perspective of risk identification, as you mentioned, in the emergency cases, you are dealing with a lot of situational things at the emergency place. So the strategy is basically to start providing the basic of the risk management. So everybody has understanding the basic fundamentals, the process, and then we're gonna go, inshallah, for the future training session to be more specific. Like, as you mentioned, like more emergency and the clinical perspective, like a patient safety perspective. So we can have more scenario-based, risk identification, and then we can focus on specifically. But in this session, I'm just gonna provide the specific guidelines that in case if anyone wanted to identify a risk or wanted to manage the risk, then what are the key steps to follow? And after following these steps, it will be easier to apply in any situation. You can even apply in your personal life. You can apply into the situation you are into. So it's all about how you report your risks, and after reporting the risk, how you manage, how the leadership is making informed decision towards that. So you can take this approach as well. Inshallah, in the future, we'll go with the specific training perspectives.
Yeah, thank you. Mr. Ziad, welcome.
السلام عليكم ورحمة الله.
عليكم السلام. مرحبا.
Thanks a lot for rich session about risk management. If allow me, I just wonder, in identification risk, the most important in risk management process. Are there any statement or formula to assign and determine risk. I just wonder about that.
Yeah, it's coming to the next slides. So bear with us. Inshallah, we'll take you through the more assessment criteria that are going to come in the next slides. So moving forward, thank you for all the questions. Any other questions, Dr. Hatem? Anyone else? Or shall I move next slides?
Yeah, I think you can move, but if you allow me just to for Hiba, I guess يعني ما شاء الله عليك, you give the statement. I would like, if you allow me, to add one point, is that risk management is an iterative process. Yes, it can go sequentially, but it is an iterative process. Whenever there is risk, you can do, and especially for emergency and for refugees, maybe you can need to adopt more agile approach. So this is maybe it needs more detail. Thank you so much again. Carry on.
Absolutely, absolutely. So moving forward to the next step is once we have the risk identification in place, then we reach to the question number 3. What are the risks that matters? As I mentioned that during the risk identification and the brainstorming session, you encounter, you come up with a lot of risk around you. You will see risk related to the environment, risk related to the resources, clinical risk, environmental risk, the challenges, many things that comes across from different people, different understanding, different aspects. But once you collect all these risks, the most important thing, what risk that matters, which one those that affects you. So basically, once you identify your those risks that matters, you need to go for the risk assessment criteria. You need to prioritize those risks in a way that go into 2 different dimensions. How likely is this risk to happen? And if it did happen, what effect could happen to the goals, either positive or negative? So the risk assessment basically will enable you to provide the guidance or the prioritization in a way to scale your risks that have been identified in your brainstorming session or your assessment that have been done earlier. So this is basically the risk scoring framework. Okay, and this risk scoring framework is basically the methodology that we have adopted. The most of the people around us, they are more into the the project management professionals. So we use the PMI methodology, which is the 5x5 prioritization criteria or rating criteria. So there are 2 dimensions here. 2 things basically is very crucial for everyone to understand how to rate and how to prioritize your risks. So as you see in the left-hand side at the top, which is the risk prioritization matrix, it gives 2 dimensions. One is the impact. At the bottom is the likelihood of occurrence. So this is the 2 dimension, for example. So how do you calculate your risk impact and the likelihood? Basically, for example, if you identified a risk that you see from your perspective, your judgment, based on your trends, based on the situation that you have seen, you see that particular risk that identify the likelihood probably is high, which is number 4. And then if the probability or the likelihood or the occurrence is high, then what would be the potential impact that you forecast or you foreseen that will cause the impact in your project or the things that you are doing? For example, you rate that impact into 4. So what exactly the simple equation of coming up with the severity level is multiply 4 by 4, which 4 by 4 multiply 4 by 4 is 16. And you reach the number which is amber at the top corner, not top corner, in the middle corner, which is number 16, which is showing that it's amber. So according to this calculation, you will come up with the severity level. Okay, I'm just going to explain what is basically the likelihood and the impacts mean. This is basically how you define the likelihood is mentioned here is a very subjective. Is basically everyone needs to define how do they see from their project perspective. For example, we define, let's if we're dealing with the project, if we are doing some sort of strategy implementation in the organization, or we do some sort of changing in different organization aspect. So we have defined the low is basically as mentioned here. For example, just a second, please. Let me know. Okay, for very low is the event may occur only exceptional circumstances or chances to occurrence between 5%. So you see some of the risk that you see, the chances is a very low, which is between 0 to 5, and the low, which is 6 to 25, medium is 26 to 50%, high is 51 to 75%, very high is more than 75%. So basically it's defined based on how do we see in our project, in our environment, in our organization. So as long as you can define these criteria that's more suitable to your organization, you can define it accordingly. But here, for the sake of giving more explanation, that we have defined accordingly, like very low 0 to 5, low 6 to 25, and very high is more than 75%. This is the chances. This is the likelihood. This is something that you see the probability that may happen or may not happen. It's not a certain, it's still an uncertain. That's why we are saying it's a likelihood. The second step is the impact. So once we see, for example, as we see in the previous slide, the very high likelihood, which I see that, for example, if I give an example, normally I give an example of if someone is driving a car, and if he's driving a car about 140 kilometers per hour, and the likelihood, the chances of accident, there are maybe moderate. If he's driving more than 160 or 200, there are greater chances that there's a risk of having the accident. So if the accident happen, then there is an impact. The impact probably is damage a car, damage a property. He might lose a life. So this kind of consequences. So the impact from this event, for example, if I gave earlier on the risk identification 3 scenarios. The 3 scenarios is basically the cause, event, and consequences. What was the cause? The cause was he was driving the car above 160 kilometers per hour. The event is basically the accident happened. The event is an accident, and the cause is either lost a life, the damage, or anything that could catastrophic situation. So this is basically how you determine based on the situation that you are into. So as long as you see the likelihood based on your own judgmental perspective, based on your own the historical data, based on the assumption that the overall trends that are telling you in the different aspect, you came up with the impact. The impact also has been defined here, because in the transformation journey or in any organization, in the clinical perspective, in the healthcare organization or hospital, this impact varies. It differs from situation to situation. And I'm given here is basically in the project perspective. So for example, if the impact of low is a very minimal impact, that will not cause a problem to my program or to my project. Even low, very low to low. Medium is a moderate negative consequence to the project delivery, but all our project or outcomes are achieved. High is an event, if it occurred, may not result the program or project failure, but it will have the high impact on the achievement of some objective and outcomes. And very high is if this event has happened, if it occurred, it likely cause a program or project failure. Inability to achieve the minimum acceptable project outcomes. So it means that if these are the defined categories or defined definition for each of the element that we determine. So based on, as I'll go back to the slide previously here, For example, as we see that some of the risks based on our own judgment, based on the scenarios or the previous trends, we see some risk likelihood is a high, which is number 4, and the impact is also 4. So 4 multiplied by 4, which is 16. The 16 is basically, if you go to the severity level here, it's very high. This is the conclusion of the multiplication, which is likelihood multiplied by impact. You will reach equal to the severity level. And the severity level is also been defined here. For example, as I mentioned, that 4 multiplied by 4 is 16. Here you can see is a high, which is between 12 to 16. That what exactly you need to do, you further need to define it in a way that what are the precautionary measures you need to take, what exactly the preventive measures you need to take in order to avoid the risk to happen or minimize the impact. So this is how you define based on the project that you are into, or based on the guiding principle that been defined by your organization, that these are my appetite level, and beyond this appetite level, my risk will be look like differently. I'm gonna come to the appetite level in the next slide. So, for example, the risk prioritization example, as I mentioned earlier in the slide, likelihood multiplied by impact multiplied by appetite equal to risk prioritization. This is a very important slide, and I want everyone to make sure that they understand clearly. If you guys having any doubt, please let me know so I can explain and spend more time into that particular slide. So as I mentioned, that the likelihood has been defined and the impact is defined. Anything that you see with this definition, you multiply accordingly. And the risk, what is the risk appetite? Risk appetite basically how much your organization can take, can tolerate the risk. So what is their appetite level? For example, if I say in my organization, from financial perspective, my organization can tolerate a risk or the impact of 50,000 real, or let's suppose 1 million real. That is their risk appetite level. This is a high appetite for them, because it will not hinder, it will not make a catastrophic change into the overall program. So 1 million is within my appetite level, which is very high. If I say my appetite level, I need to define what is my low appetite. That if reach to the low appetite, that is catastrophic. For example, if I see any program or any incident will cause a 10 million financial loss, then that's appetite is low for me. That's low. I cannot tolerate having a loss of 10 million because this is beyond my appetite level. This is beyond my tolerance. I can't digest more than that, this loss. Maybe I need to stop the project. Maybe I need to do the different intervention and so on. So basically, the appetite levels need to be defined by the management. That how do they see the financial perspective, what is their appetite level, the strategic perspective, what is their appetite level, even the operational level appetite. They need to come up with their appetite level in order for the calculation to come up with the prioritized numbers. So as I mentioned here, the likelihood multiplied by impact multiplied by risk appetite. For example, if I say likelihood is almost certain, risk is which is going to happen, which is 5, and the impact is 5. So 5 multiplied by 5, how much? 25. And 25 multiplied by 5 is how much? Is 125, isn't it? So the risk prioritization equal will be highest, which is here you can see between 75 to 125 is the highest risk prioritized. So based on the risk prioritization, you need to further define the escalations. Okay, for example, if I'm a project manager and I have the line manager, and then on top of my line manager is a director, and then there's a VP, and there's a CEO, and there's a board, and so on. So I need to define the risk prioritization. How do I need to escalate the risk based on the prioritization? For example, if I see a financial risk, and my appetite is very low, and the prioritization equal is coming to between 75 to 125, then I need to define that my escalation, I need to escalate that risk that go directly to the CEO. The CEO need to have the visibility of that particular catastrophic risk in order to make the informed decision. Because unless we do not escalate and we do not provide the visibility of that prioritized risk to the leadership, then there is a greater chance the risk to be materialized. And that's what is all about the risk management, that we need to make sure that we need to minimize and mitigate the risk in order to minimize the risk impact. And this is all going to happen when we do our calculation accurately, when we see the risks that will hinder or impacting our all project or the program that we are working in. So this is a very important slide. So I wanted to open the floor for more discussion for 2 to 3 minutes. I want to ask anyone if you have any question in particular to that particular slide.
Yes, please. Now, this is to me interesting topic about prioritization, because this is also the base of response. So any
Absolutely.
question? Yeah, any questions so far? تفضل زيد. تفضل يا زيد.
السلام عليكم ورحمة الله.
عليكم السلام.
I just wonder if allow me.
Yeah, sure, go ahead.
I know how to determine likelihood impact, but risk appetite, low, moderate, and high. How to determine this in most accurate?
All right, so this is a great question. I'm coming to the next slide. If anybody has any question.
Yeah, there is
No,
question.
thanks.
Yeah, there is question also from.
Just I wonder about.
Yeah.
Okay, Dr. Hatem, let me explain the second slide, then we go for more questions.
Excellent.
So,
excellent.
Okay, this is basically the risk prioritization matrix. As I mentioned, that the impact likelihood multiplication that we can reach to the exposure, and then the risk categories. The defining the risk categories is equally important for understanding the risk appetite. For example, you know, once you start your risk identification, I mentioned earlier on that you need to come up with the risk categories. That what are the key areas that your organization are dealing with? Okay, your organization are dealing with the clinical things. Your company is dealing with more like, you know, the selling products. It's a branding, it's a regulation perspective. So for example, I have mentioned here few risk categories, like for strategy, clinical, brand and reputational, regulatory compliance and fraud, operational, information technology, financial, and people and culture. So these are the key risk categories that have been defined that are most suited to my organization or to the work that I'm doing. And based on this categorization, this category, I determine that my appetite level in the strategic impact is very low. And if I define or identify any risks that are impacting our strategy, then it's a low for me. Then because I cannot tolerate the impact that are preventing my strategic objectives. So I gave this particular category a low rate. The clinical risk. This clinical risk is basically you are dealing with the patient. You cannot afford of having medium or high appetite level in clinical aspect. It's always going to be a low because you are dealing with the patients. And patient safety is always been considered as a most low appetite level risk category. And then the brand reputation on this. So basically, once you define your categories, you can come up with the level of your appetite. You know, for example, the appetite level varies. It's different from organization to organization, from situation to situation. If you are if you are a doctor, then your appetite level in dealing and writing the prescription, for example, you know, there are error in the prescriptions, you know, dispensing the medication and from the pharmaceutical side, and making sure the prevention of the chronic disease. If you determine there are greater chances of you know, prevalence of the chronic disease, then these are the risks of your area. For example, diabetes, for example, hypertensive. So you can see within your catchment area, the population that you are dealing, if you determine that my population within my catchment area, their chronic disease level is very low. And then accordingly, you need to come up with the calculation and define the risk response strategy over there. And once you define this, then the calculation will happen as I mentioned here. For example, you know, the likelihood and impact calculation and the appetite as you have determined through your categories, and then equalization will come as the risk prioritization. And this risk prioritization will lead you to put up your response strategies, which is coming to the next slides. So, okay, so for example, I'm just giving you some more clarification in this aspect. This is basically the risk register, where you basically identify, there are some titles here. For example, you know, the risk titles, risk description. So risk title and risk description is very important. And then you need to put up the risk owner and categories. You can see there's a categories. The categories are subjective with the appetite level, risk appetite level, whether, you know, operational. For me, operation is moderate. But when I talk about the strategic, it's a very low appetite for me, okay? And then likelihood, as you already know, the calculation, which is multiplication from the risk prioritization matrix, you do the multiplication. And then equally, once you calculate all these numbers, you will reach up with the prioritization, which you see at the right side corner. There are some prioritization which is reaching to the 100, which is severe. And this severity level, you need to come up with the escalations, that how you need to escalate this. So I'm going to come to the next slide, but I'm just going to ask more questions. Yeah, is it clear to you, Mr. Zaid?
Yeah, so thanks.
Yeah. Any other question, please?
Tabrika, is it clear for you the risk appetite?
صحيح, clear. Crystal clear, alhamdulillah. So thanks.
Okay, thank you. Just carry on, Mr. Adnan.
Yeah. All right. So we talk about this part, and finally, when we do that, we come up with the prioritized risk register after prioritization. As we see, there are a certain risk ranking, risk title, risk appetite, exposure, and prioritization. Okay, so this is basically how we determine in the risk assessment side. I think there are some questions here. Let me see, what is this? Okay, thanks. Okay, clear. All right, so no questions here. I'm not going to spend some time, but I'll just give you the reflection of this particular slide. As I mentioned earlier on, as long as you define categories at the top on the column, you can see these are the categories: compliance, organizational, clinical operation, operational support, cost, budget, time scale, reputational, health and safety, environment. So these are the most, useful categories being used within the health organization, within the health systems. Actually, the compliance, make sure that we comply with all these standards led by the Ministry of Health, with the other, clinical guidelines and so on. So then we need to define it. Actually, as long as we can define these categories to the level of, we see that how catastrophic, how very high impact gonna look like in this category, we need to reflect into these categories. with these definitions. So this is just an example. Maybe we're going to talk this later on because it's take a little bit longer time. So the first three questions provide us the most prioritized list of uncertain that matters. After these three, we just need to make sure that we need to analyze, develop risk response to exploit good risk and avoid threats. For this, just a second, I am having some problem with my net or what? Okay, just a second. Okay. So question number 4 here, what shall we do about it? This is the most important, as otherwise we are just victim of uncertainty and things might happen to our project which won't expected. So for example, before analyzing, as we know that we have already determined the risk that's gonna impact. So what we're gonna do next? This will lead us to risk response strategy. The risk response strategy consists of 4 areas. Basically, I have just removed the exploit in other areas, which is 5 or 6. I'm not sure. I think it's 5. So avoid, mitigate, accept, and transfer. These are the key areas that we develop the risk response strategy. Once we put up the risk response strategy, number 1 is avoid. So we identify the risks, we put up the risk description, we did the risk assessment, and then based on the risk assessment, we need to know what exactly we are going to do with that risk. So number 1 is avoid. What does avoid mean? Avoid means that we do nothing. Okay, so we need to eliminate the condition that allow the risk exist at all, most frequently by dropping the initiative or eliminating the project task or completely dropping the project. So avoid, because this type of risk probably is a catastrophic risk. It is too risky to have to run certain initiative, project or strategy that will determine the impact is really catastrophic. So we don't want to take that particular risk. So we say, okay, we avoid. We don't want to deal anything. We want to do anything to that. Just either to eliminate the particular area that are causing the catastrophic impact, or drop the project completely. This is number 1. Number 2 is the mitigate. So mitigation is basically once we have we did the risk assessment, we came up with the risk response by mitigating the impact. So mitigating the impact is basically we are just minimizing the impact by taking different actions, different course of actions. For example, I gave the example of the guy who was driving a car over 160 kilometers. Okay, so the mitigation of this is to make sure that he would not drive the car more than 120 kilometers. So this is how we minimize the impact. This is, if we know this particular guy is driving always like 160 or 200, so we make sure that the person will not drive more than 120. So that's the mitigation action. So that's the mitigation that we make sure that this control is already in place, and we manage this. There is another one thing is the controllability. The controllability is one of the area whenever you start mitigating or developing your risk response, you need to look at the controllability. What are the existing controls you have in place that will help you to minimize the impact of the risk that you are seeing? So this is basically the controllability is mean. For example, sometime you are running a project, you have the lack of resources. You don't have resources in place, and you cannot run your project because you don't have the resources. So what are the existing controls? You might go to the HR and say, guys, I have this project. I have a certain timelines to achieve my project, but I could not because I don't have resources. To the existing control perspective, the HR will provide you some resources within the organization who will help you to execute some of the action, to execute your project, to achieve your timelines. So this is basically you did not hire from outside. You took it from the internal control. You took it within the organization. So this is mean that internal control that you need to look around if there is any possibility that you could use that will help to minimize the impact. You make sure that you need to also assess these areas as well. And the mitigation, as I mentioned, that if you don't have, it's only about the resource. You go and find the resources and make sure that you complete your project. And that's the mitigation one. Number 3 is the accept. Okay. Sometimes you see the risks assessment reach to the level that is still you see this within my appetite level. I don't see that will hinder massively in my project or the execution of whatever I'm doing. So you say, okay, I accept the risk, but at the same time, you make sure that you have the contingency plan in place in case if risk happened or you're seeing the course of some indication that will lead of some of the risk. So you apply the contingency plan and make sure that this risk's being controlled by taking different measures. Number 4 is the transfer. The number 4 transfer is basically in the most of the organization, they transfer the financial risk to the third party in order to have the risk sharing. So, for example, some organization, they see or a function, they see a risk that are not related to their own function. They are related to sometime, you know, the HR, sometime the IT function, sometime a different function. So, but ultimately this is not related to your function. So what you do basically, once you identify, you transfer that risk to that particular department or to the particular area for them to accept and put up the right mitigation strategy to minimize the impact or avoid the consequences that are expected to happen. So this is basically the 4 risk response strategy everybody should think about in order to manage the risks that have been put forward for managing the risk. Where is it? Okay. So once we have the risk response in place, we conduct the periodic review sessions. Okay. The risk response strategies has been taken into account, and we look at the risk, reassess risks. So sometimes what happened, so you identify the risk, you did the risk assessment and analysis, you develop the risk response strategy, and now you have defined certain action in order to minimize the impact. During the course of implementing the risk response strategy or the action that you put forward to minimize the impact, you make sure that you reassess the risk impact. Sometimes you put the plans and then in the middle you see that risk still remain the same. There's no change you are seeing that are minimizing the impact. So you make sure that you on timely basis, you go back and reassess the risks and see the trends, that how it's moving forward, the action that you are taking, how the action are effective. If it's not effective, then you need to change the risk response strategy. You need to change the plan. You make sure the plan that you are putting there is minimizing the risk impact that you are seeing there. So you conduct review sessions, risk review session. So this is basically the high-level risk management process, where number 1 is the risk identification, which we talk about the top-down and bottom-up. You assign the risk owner. You log risk into the risk register. Number 2 is the risk, the analyze and assess. You do one-on-one session. For example, if you have in your organization a risk manager or risk department, that particular department will go to that particular project manager. They do the risk analysis, they do the risk assessment, and make sure they use the proper method in order to determine with the risk analysis and assessment. And then number 3 is a risk response plan. Risk response basically is defined in a smart way, which is simple, measurable, attainable, relevant, and timely. We make sure that we must need to think about that whenever we are putting the risk response plan, we need to take into account that we need to minimize before the risk to materialize. if risk materialize, if risk happen, it become an issue. So we make sure that we put our risk response strategy in a timely manner before risk to happen. And then the final is the monitoring and reporting, which is the later stage, which inshallah next time we're going to talk about. So yeah, so I open for a question. Yeah, go ahead. Any question?
Yes, thank you so much. It is interesting. Any questions so far? Yes. And thank you, Mr. Adnan, to make it more interactive. So people are not going to sleep.
Yeah. It's not interactive to the extent that I wanted, but since the time constraints, I'm just gonna wrap up this in 5 to 10 minutes, inshallah.
Inshallah, yes. Any question? Yes, any question, Ya Shabab?
Okay.
Yeah, carry on.
So this is basically a more interactive session. I'm taking this exercise into the risk register manner. So as you know, we start with the putting up the risk ID. Risk ID, normally you can use the way you see most appropriate. You know, here I give some example, academic and training affairs, change management, clinical services. You can use the first 3 alphabets and then the numbers to determine the risk IDs, and in case if you don't have the risk management system, so you can manually use the risk register and put up this, IDs in there. The second thing is to put up the project name. What is the project name, and the risk that you have identified is related to what scope. So put up the risk scope name here, and then the number the risk title is basically should be very concise, very small, that are reflecting the risk description. So for example, I mentioned here lack of stakeholder buy-in is one of the risks. So we do not want to write up a long statements here. The risk title should be 3 to 4 words that describes the risk itself. The next is the risk description. As we speak, the risk description consists of 3 elements, which is cause, event, and consequences. So as we speak earlier, the cause is basically is the source of the risk event, and the event is the incident or occurrence that arises from the cause, and the consequence is the effect arising from the risk event. So we just wanted to make sure these 3 elements are covered in the risk description, and then we need to write the risk owner name. Make sure that the risk owner should be an individual, not a department nor a function. Because if you put up the risk owner, a department or function, you will be lost because nobody will gonna take up that risk particularly, and then you're gonna be looming around. So make sure that if it's whatever the risk identify, you put the risk owner name, individual name, not the department or function. So as we speak, the risk analysis cause, what will cause the risk event to occur, and then risk impact and risk likelihood, controllability, type of risk. So this basically, and the impact, like this basically determines all that we talked. So I'm not going to spend more time unless if you guys wanted to have more clarity. I'm going to share with you the risk register, having this explanation in the different tabs. It has a calculation already determining the risk, calculation and the prioritization and appetite level. This will help easily to determine the key, the risk identification and so on. So these are the key definitions. We talked about the risk is an uncertain event that may happen and may not happen. Issue is something that has already happened. Risk analysis is a risk identification process. Inherent risk, that level of exposure arising from a specific risk before any action has been taken to manage it. Residual risk is, we talk about, which is the remaining after risk response been taken forward. And risk response strategy is the 4 key response strategy, which is avoid, mitigate, accept, and transfer. Risk culture, we talked about, we make sure that, the risk being considered and adopted by the organization, by its value, beliefs, knowledge, attributes, and understand across the organization. And the risk appetite, we talk about the amount of the risk that organization is willing to accept to specify the level of exposure to uncertainties in the business activity across the organization. So make sure the risk appetite level is the risk the management is willing to accept. Anything that are not acceptable level is going to be a very low appetite. The risk owner is the individual, risk manager is the one who will be making sure and maintaining the risk register. And the risk tolerance, we haven't talked about the risk tolerance actually. The risk tolerance is the degree of uncertainty that management is willing to accept in respect to the negative changes to the consequence. So it's similar to the appetite, but the tolerance is sometimes, you know, you are taking some risk, but you still have the tolerance of managing that particular risk. So you still see, okay, I have the tolerance of managing to a certain level, and if it's reached beyond my tolerance level, it will be escalated. So these are the key definitions. Now I open the floor for discussion. That's the end of my today's session. Thank you.
Thank you so much. Thank you so much, Mr. Adnan. This is very interesting, and I think those who are interested in R&B, they just go and register for exam, because you mentioned all the trick here. Thank you so much. Hiba, welcome, Hiba.
Thank you again. I have enjoyed every step. I would like to ask about the last point Mr. Adnan mentioned. He speak about the risk tolerance and different appetite. From the beginning, risk appetite was clear, but when he mentions the risk tolerance, is get somehow complicated. If he please try to make it more easy. Thank you very much.
Okay, as I mentioned, the risk tolerance is the level of acceptance, you know. For example, I mentioned, like, for example, in any organization, they see they have 1 million financial impact is within their tolerance level. They can tolerate this 1 million loss, but anything beyond that is cannot be tolerated. So this is there's a very thin layer between the appetite and the tolerance. The appetite, basically, as we speak, that is anything based on the categories, because we have defined the categories and we put up the appetite level of that particular categories. But tolerance is not defined, because we just need to assess on during the course of the mitigation plans and see, okay, this action has been taken, whether this is within our tolerance. Okay, this we can tolerate that much, you know, a gap or the risks or the, you know, the threat. But we need to make sure that it should continue and prolonging and managing things.
Yes, thank you. And I think also, Mr. Adnan, since it is discussion, I think sometimes the stakeholder risk profile differ. Some of the managers, for example, they don't like risk. And this is they risk averse. They always would like to live in a comfort zone. They don't like uncertainty and working business as usual. Some are risk seeker, those who would like to go for al-makhatir, and so on. So it is very important for people definitely to identify the stakeholder risk profile in order to arrange the risk. What do you think?
Absolutely, absolutely, Doctor.
Yeah. Any questions so far? Aina Asiri? Hamid Asiri. Yes, any question?
I am here, yeah, Dr. Hatem, but too
Yalla,
noisy
welcome.
here.
You have a question or something?
No, I don't have any questions, but there are too much noise around me.
No problem. So you have to mitigate for the risk next time.
I am planning, actually.
You go at a comfort place.
Okay.
Actually, the issue of the risk sometimes, correct me, Mr. Adnan, risk actually, we use it in a daily life.
Absolutely.
Yeah, sometimes if you would like to travel, you just ensure that your car is full. And sometimes there is risk trigger when you see the light of the petrol. This is just like risk trigger. And I asked some of the friend, he said one of the risk is when he give his card, the Visa card to his wife. And I asked him how he mitigates this risk. He said he put a limited number only, like 2,000, 3,000. So this is good risk mitigation.
But doctor, there is a consequence after limiting. Yani you have to bear the consequence after limiting this number. there is another risk coming out, residual risk coming out of this.
So risk is a normal phenomena. Any questions so far? The presentation is recorded. Inshallah, we'll share it for those who would like to go for it. Any question? And I think there is a lot of need, Mr. Adnan, for the a proper training program in risk management. Inshallah, we'll try to arrange that because this is need workshop, need discussion, as you mentioned.
Absolutely, doctor. This is basically, the idea was just to have the initial understanding on the key areas, so they understand what is the inherent residual risk response and all this. Then we're going to go more practical and more test scenario basis, as will be more interested to the audience as from the different backgrounds. So we make sure that we use scenario-based approach and make more attractive and understandable.
Yeah, excellent. زيد, حيا الله زيد, تفضل.
الله يحييك دكتور حاتم. So thanks for so interesting and informative session. I would like to thank you and Mr. Adnan. And just small questions. Mr. Adnan, no risk meta language, which mean case, risk, and effect in risk management process. But I wonder if other formula I can use to determine and assign risk, other risk meta language. So thanks.
Yes, Dr. Zah, what I'm going to do basically, as assessing the risk is basically, it's not all about, a calculation methods. It's about, understanding the severity of the risk that we are seeing and assessing. As long as we are very much confident of based on our assessment and based on the calculation we are doing, then it's fine. If we see the doubt in terms of the risks not going the way that we see, or not being assessed the way we assess, then it will ultimately it gonna give different indications in different stages. So what I'm gonna do, I'll share with you the risk register, which is very much comprehensive and very adjusted with the technical aspect to it, and it has all the scenarios as well as the rating criteria has been defined there, reflected and auto filtered. So it will help definitely to determine and calculating these areas. And then in case if you have further questions, please feel free to contact me anytime. We will go one-on-one in that perspective.
Thank you so much.
My pleasure. So thanks.
Thank you so much. People also asking for the presentation after recording. Inshallah, we'll send it to those. I will put my number so we can send it by WhatsApp if you would like in the group. So any question? Yes, any question so far? So if there is no further question, I would like to take this opportunity. Thank you so much, Mr. Adnan, for the interesting topic, a lot of information, and definitely this is also open our appetite for further discussion and reading for risk management. I would like to take this opportunity to announce for the next week, inshallah, 10 April, we will have another topic, important topic, which is change management in healthcare. This will be delivered by Mr. Robert Corner. Robert Corner is a subject matter expert who worked for many years in UK about the primary healthcare transformation, and now he is working as subject matter expert for primary healthcare transformation in Al-Hasa cluster. And the week after, inshallah, we will go to Ramadan Kareem على الجميع, and definitely we will continue Ramadan on 17 April at 10 p.m. يعني بعد التراويح. Inshallah, we will have another interesting session with Professor Zuhair Subai and so on. Thanks again, and would like to thank everybody. Thanks again, Mr. Adnan. Thanks for those who attend this session. والسلام عليكم ورحمة الله تعالى وبركاته.
Thank you so much. Assalamu alaikum.